toddlers. Same age, same number of words. Completely different developmental stories. One toddler eventually catches up and starts talking more. Another receives developmental support and is later identified as autistic. So what was different? And if your child is not talking yet, what should parents actually watch for? Because most people think this question starts with speech, but child development experts often begin somewhere else. Connection. This video is not about diagnosing autism. It is not about labeling children. It is about helping parents observe thoughtfully, understand what science actually says, and know when professional support may be worth considering. And what you learn may surprise you. For many parents, concerns do not begin dramatically. They begin quietly. At the park, at daycare, at a family gathering. You notice another toddler talking, asking for snacks, pointing, naming things. And then you look at your child. Maybe they are quieter. Maybe they use only a few words. Maybe they seem happy, but not communicating in the same way. And suddenly, one question appears. Could this be autism? If that thought has crossed your mind, you are not alone. Speech concerns are one of the most common reasons families seek developmental advice. But here is something important. Speech delay alone does not tell us enough. Children talk later for many different reasons. And this is where many internet conversations become too simplistic. Speech and communication are not the same thing. This distinction appears repeatedly across child development and autism research. Organizations including the American Academy of Pediatrics, CDC, and developmental researchers across North America, Europe, and Australia describe communication as much broader than spoken language. Communication begins before speech, long before speech. A baby turns toward your voice, looks at your face, smiles, shows excitement, points, brings objects, looks back at you, wants to share moments. Those behaviors are communication. Words are only one layer. And this is where many professionals start observing. Not how many words does your child know, but how does your child connect? Imagine these two children. Toddler A says very few words, but points constantly, looks at parents, brings toys, laughs socially, copies actions, wants to show discoveries. Toddler B also says very few words, but rarely points, rarely tries to share experiences, seems more focused on objects than interaction. Same speech level, different communication pattern. Researchers sometimes describe an important part of this as joint attention. Joint attention simply means your child notices something and wants you to notice it too. That airplane, that dog, that bubble. Studies from developmental research programs and child communication research, including work summarized by the U.S. National Institute on Deafness and Other Communication Disorders, part of NIH, have shown that joint attention is deeply connected to social communication development. Researchers at institutions including Yale Child Study Center and developmental autism programs internationally have also studied these early interaction patterns for many years. And this matters because autism is not defined only by delayed speech. This next section may be the most useful part of the video, not because it gives answers, but because it gives better questions. Observe gently, not constantly, not anxiously. Just notice. When your toddler wants something, how do they communicate? Words? Sounds? Gestures? Looking? Bringing your hand? Do they try to involve you? When something exciting happens, do they try to show you? Do they point? look back at you, smile together? If you call their name, what usually happens? Not every time. No toddler responds perfectly. But generally, do they notice? Do they enjoy simple back-and-forth moments? Peekaboo, copying, sharing reactions? How do they play? Do they imitate everyday actions? Pretend to feed a stuffed animal? Pretend calls? Simple imagination? Again, none of these things alone diagnose anything. Professionals look for patterns across time, across environments, across development.
Here is something many parents misunderstand. Seeking support does not mean believing something is wrong. Developmental screening is information. That is all. In the United States, the American Academy of Pediatrics recommends developmental monitoring and autism screening during routine care, including around 18 and 24 months. The Centers for Disease Control and Prevention supports developmental monitoring and encourages parents to discuss concerns early. In Canada, guidance from the Canadian Pediatric Society emphasizes that developmental concerns should not simply be dismissed as wait and see when concerns continue. In the United Kingdom, developmental observation is built into child health systems and focuses on communication, interaction, and developmental milestones. Australian child health guidance also encourages early discussion of developmental concerns, rather than waiting for certainty. Notice the common message. Not panic, not diagnosis. Observe, ask, support.
Development is not linear. Some children understand much more than they can express. Some speak later. Some are quiet. Some are cautious. Some need more time. A child can be late to talk and not be autistic. A child can dislike eye contact sometimes and not be autistic. A child can love routines and not be autistic. Single behaviors rarely tell the story. Patterns matter. Context matters. Development matters. Parents often ask, when should I seek help? Not because they want a label, but because they want clarity. Consider discussing concerns with a pediatrician or developmental professional if you consistently notice very limited attempts to communicate, few gestures, little pointing or showing, limited social interaction, loss of skills, ongoing concerns that are not improving over time. You do not need certainty. You do not need proof. You only need concern. If there is one thing I hope stays with you, speech delay and autism are not the same thing. And words are not the whole story. Sometimes development reveals itself in tiny moments, a shared look, a pointed finger, a smile that says, "Did you see that too?" Children communicate long before they speak. And support is not failure. Support is information. Support is understanding. Support is opportunity. If you enjoy thoughtful, research-backed insights into child psychology, baby development, and toddler behavior in a clear, research-informed way, subscribe to Childhood Examined. We turn science and trusted expert research into clear, calm, easy-to-understand videos that help you better understand growing minds. Subscribe and join us for the next episode of Childhood Examined, because childhood deserves to be understood, not guessed.